Less than a third of the 400 nurses working at the Kinema Government Hospital are paid. Adam Akala says she was promised she would be put on salary after she spent 2015 working at an Ebola treatment unit, or ETU.
Up to date, they have not yet enrolled us. I'm still not paid. I'm not feeling good. I'm feeling bad. I'm just thinking that if I lose my life during the time, so that is all my children are going to suffer just like that. So I regret it to work at the Ebola Center.
And that is the concern here, that if another health emergency strikes, volunteer nurses may not answer the call again. This hospital in Kinema was the first place Ebola appeared in Sierra Leone. Some of the nurses who treated Ebola patients got hazard pay, but after the ETUs closed, many had to go back to being unpaid volunteers.
We are not denying that it may not have negative impacts. If we have too many volunteers, that may have to slow down the work. There may be sometimes people will be demotivated. It could even contribute to the other workers who have been paid to be demotivated.
Dozens of healthcare workers at the Kinema Hospital got Ebola, likely while caring for patients. 40 of them died, including revered virologist Dr. Sheikh Umar Khan. The health ministry says it is working with the World Bank to give the family of each health worker who died $5,000, though no money has been dispersed yet.
Until now, I'm not feeling happy. At any time when I remember Dr. Khan and my colleague, the tears run my eyes. It was not easy.
Fatimata Cisse says she got Ebola treating a fellow nurse who had the virus. At the time, she was wearing protective gear designed for Lassa fever patients, not Ebola. But that was all the hospital had. The nurses say one improvement since the epidemic has been the training on infection prevention and control, known as IPC.
Because the IPC have made us to know that we are risking our life before Ebola. We are, even if it is not Ebola patient, but we have another disease that will affect us.
Cholera, hepatitis, Lassa fever, there are quite a few infectious diseases that could show up at this hospital. And the nurses say at the very least they are better prepared, though they would like to be paid. Ricci Shryock for VOA News in Kinema, Sierra Leone.